Confession from a pediatrician. Even pediatricians' kids get a number of ear infections, like a ridiculous number. My daughter had her own ear infection journey, and we had lots of middle of the night screaming sessions. She eventually ended up getting a set of ear tubes, and honestly, they helped her out quite a bit. So, what are ear tubes and why do we use them? Some kids get recurrent ear infections or fluid trapped behind the eardrum over and over. That fluid basically becomes pressurized pocket of bacteria, causing pain, pressure, and hearing loss. When that keeps happening, an ENT might recommend pressure equalization tubes. They're like tiny tubes placed in the eardrum that kind of act like a ventilation and drainage system. Instead of infection being trapped, fluid now has like a way to escape. And if that infection happens, treatment can often be antibiotic ear drops directly into the middle ear instead of oral antibiotics, which, if you've ever medicated a toddler, you know is an adventure. Another big reason we think about tubes is hearing matters a lot for language development. In toddlers, if there's constantly fluid that's muffling their sound, it can affect speech development. The procedure itself is pretty quick, usually done under light sedation, not general anesthesia. The tubes typically stay in place for a year or two, or sometimes even more, and then naturally fall out once they've done their job. Tubes aren't the right choice for every child, but when pediatricians and ENTs agree they can be helpful, then they can make a huge difference for kids and for parents.